If your MRI says you have an L4, L5, or L5-S1 disc bulge or herniation, is your sleeping posture or sleeping position making your pain and disc condition worse? In this video, I'll show you the sleeping posture you must avoid, or it will give you the most horrible sleep and continue to cause you pain at night. I'll also show you the absolute best way to sleep when you're suffering with low back pain or leg pain because of an L4, L5, or L5-S1 disc bulge or herniation. These specific tips and strategies will ensure you're getting a comfortable sleep at night, giving you the much needed relief so that you can get a good night's sleep, which we all know is so important to healing and functioning at your best. The key thing is to be in a position that avoids disc bulge or disc herniation aggravation. Keep watching and I'll show you how. Hi, I'm Dr. Steve Silverston. I'm a chiropractor in Ellicott City, Maryland, here at World Class Chiropractic. I bring you over 30 years of clinical experience helping people recover from conditions like low back pain, leg pain, sciatica, neck pain, upper back, shoulder, arm pain, headaches, and more. This channel is about giving you tips and strategies to live a pain-free, healthy, and fulfilling life. Before we dive in, be sure to subscribe to my channel if you're looking for ways to enjoy a life free from pain and filled with health and joy. I upload a new video every week. It's important to know how spinal alignment and posture affect your sleep because different positions can change the pressure on your spine, possibly increasing pain in sensitive areas like the L4, L5, and L5-S1 regions. So the best position for sleeping is on your side. The next best is on your back, and the worst is on your stomach. I'll explain why and the pros and cons of each of these positions. And make sure you watch this video right to the end because I'll also review the proper way to get up and down from a lying position to help protect your spine and nerves from further injury and inflammation. Let's first review the wrong way to sleep. The worst sleeping posture is on your stomach. I'm a former stomach sleeper, so I know it can feel good to have your belly against the bed, and it can even give you a feeling of comfort and security, but that's usually very short-lived and will ultimately not feel good because it puts a strain on the base of your spine and as well as on your neck. And it'll likely aggravate L4, L5-S1 disc bulges or herniation. It can also put pressure on your internal organs like your lungs or your stomach, inhibiting breathing, digestion, and worsening conditions like gastric reflux. Sleeping on your stomach also may not provide the most restful sleep due to tossing and turning, trying to find a comfortable position. So if you're a stomach sleeper, I would recommend changing to a side-lying position. And if you find it difficult to change, I would recommend gradually breaking this bad habit by turning slightly to the side and supporting yourself with pillows to incrementally get to the best position, which is on your side. The second best position for sleeping with a lumbar disc bulge or herniation is on your back, which can really help relieve low back and leg pain. But if you're going to lie on your back, I would recommend you do it for shorter periods of time and not sleeping that way all night because it could inhibit breathing, increase snoring, and worse yet, I recently read an article stating that sleeping on your back with your head at body level for more than 2 hours per night has been found to increase a senior's risk for developing dementia by 4 times. That's because when you sleep on your back, your tongue falls back and partially obstructs the airway, which results in less blood flow and oxygen to the brain. Not a good thing. So it's okay to lie on your back. And in fact, it can be relieving to your low back or leg pain, especially from an L4, L5, or L5-S1 disc bulge or herniation. But I wouldn't sleep that way all night. Here are some tips when lying on your back. Put a pillow or pillows under the thighs or knees to relax and relieve pressure on the low back. If you have an L4, L5, or L5-S1 disc bulge or herniation, it'll probably feel great to do this. Even better, if you can, is to completely elevate the knees to a 90-degree angle by putting your legs all the way up on boxes or cushions. This can take all the pressure off those discs and really feel great. Also, put an ice pack on your back for 10 to 20 minutes at a time. You can reference this video for more detailed instructions. I would recommend doing all this before going to sleep, but the best posture while sleeping all night will be on your side. Lying on your side can be ideal because it allows for the proper natural alignment of your spine while you're sleeping. In most cases, flexing the hips and bending the knees, like getting in a fetal position, will help because it opens space between the bones, taking tension off the discs and pressure off the nerves. Also, putting a pillow between your knees will help keep the spine and pelvis in a neutral position relieving stress and strain. It's also really important to support the neck, because if you think about it, when lying on your side in a neutral position, the shoulder sits out here, then the neck comes in, then the head comes out again. So if your neck is not properly supported, it'll put stress on the spine, which can cause problems not only in your neck, but this can affect your whole body, including your low back. So I would highly recommend investing in and using an orthopedic pillow to give optimal support to your neck and spine while sleeping. Adjust the pillows to your body so there's no strain on your neck or back. Think about and visualize your spine being in a nice neutral position, and make sure the pillows are supporting that. It's really important to get a good night's sleep. That's when your body and your brain does most of the healing and repairing. Also, it's really important and can make a big difference how you get in and out of bed. So let me go over that with you now. To minimize the stress and strain on your spine when getting up and down, it's more ergonomically correct and easier on your body to do it from a side-lying position versus flexing forward at the waist. When you flex forward or backward, it puts a lot more stress on your spine, even if you don't feel it. Those stresses accumulate and can be painful, but even if you don't feel it, it can be weakening your body, causing inflammation and prolonging healing. So the best way to get down is to first sit, then go down onto your side using your arms to assist while swinging your legs up. And then from a side-lying position, you can gently wiggle onto your back. This will be much easier on your body and especially those discs. When getting up, take the extra time and effort to first get to a side-lying position, and then push yourself up with your arms while swinging your legs forward to get up much more easily and effortlessly. It may seem like extra effort in the beginning, but after you get used to it, it is actually easier and your spine will thank you. I've seen these tips help countless patients get more comfortable in bed and allow them to get a better, more restful sleep. And I hope these tips help you get a better, more restful, and health-restoring sleep. Dealing with an L4-L5 or L5-S1 disc bulge or herniation and the associated low back pain and leg pain can be very challenging. I understand what you're going through. Over the past 30 years, we've helped thousands of patients recover from conditions like disc bulges or herniations using non-surgical methods. You can get through this. Your body has the God-given ability to heal when it's given proper care and support. And the supportive sleep posture I just showed you can really make a difference. So be sure to also get a thorough spinal checkup with a corrective care chiropractor if you want to start correcting the root cause of your disc injury, which can truly help speed up your recovery. And give these supportive sleep techniques I just showed you a try, because they can make the difference between a terrible night's sleep and a comfortable night's sleep when you're recovering from an L4-L5 or L5-S1 disc bulge or herniation. Now, I would love to hear from you. How does your disc problem affect your sleep? Please comment below and let me know. If you found value in this video, be sure to like and share it so others can benefit from this as well. And it really does help the YouTube algorithm get the video out to more people. Also, go ahead and subscribe right now if you want to learn more ways to enjoy a life free from pain, filled with health and joy. The next video you should watch is this one. You will learn the 3 best mobility exercises for L4, L5, or L5-S1 disc bulges or herniations that are great to do just before bed. Click here to watch that video next.